Welcome to 3D Anatomy Videos, lecture series by KHRMS. In this tutorial, we are going to know everything about the cavernous sinus. First of all, let's see the location of cavernous sinus. Cavernous sinus is situated in the middle cranial fossa on each side of the sphenoid bone. Here you can see, is the cavernous sinus. Coming towards its boundaries and relations, anterior to the cavernous sinus is the superior orbital fissure, which we can see in this lateral zoomed view. Posteriorly, the apex of the petrous part of the temporal bone is present, which is also seen in lateral view. There is another relation posteriorly, that is the mesencephalon or the midbrain. The temporal lobe of cerebral cortex is present lateral to the cavernous sinus, along with the trigeminal ganglion, which is also present laterally. In medial relation to cavernous sinus, there is the hypophyses cerebri or the pituitary gland. Let's see the superior relations of the sinus. We have the anterior perforated substance of the brain here. Also, we have the optic tract, the olfactory tract, and the internal carotid artery. They all pass superior to the cavernous sinus. Inferiorly, we have only the presence of the junction of the body and greater wing of the sphenoid bone, which you can see here in the inferior view. Let's talk about the contents of the cavernous sinus. Here we have taken a cross-section through the cavernous sinus. The internal carotid artery passes inside the substance of the sinus. One more thing that passes inside the substance is the abducens nerve, that is the sixth cranial nerve. In the lateral wall of the cavernous sinus we have three things present: the oculomotor nerve, that's the third cranial nerve; the trochlear nerve, that is the fourth cranial nerve; and the ophthalmic branch of trigeminal nerve, that is the fifth cranial nerve. Coming towards the tributaries of the cavernous sinus, these veins drain into the cavernous sinus. 1. The superior ophthalmic vein. 2. The inferior ophthalmic vein. 3. Central retinal vein. 4. Sphenoparietal sinus. 5. Inferior cerebral veins. 6. Superficial middle cerebral veins. 7. The anterior and posterior intercavernous channels. 8. Pterygoid venous plexus. Let's talk about the drainage of the cavernous sinus. The sinus drains into superior and inferior petrosal sinuses. The inferior petrosal sinus drains directly into the internal jugular vein. On the other hand, the superior petrosal sinus drains also to the internal jugular vein, but through sigmoid sinus. From internal jugular vein, the blood is drained into the superior vena cava via brachiocephalic veins. Now, we are going to discuss some dangerous connections of the cavernous sinus by which infections can pass and lead to pathologies. 1. Angular facial vein has a connection with ophthalmic veins. Two. Basilar sinus connects petrosal sinuses of opposite sides and communicates with vertebral plexus. Here you can see the basilar plexus. Now let's see some clinical conditions related to the cavernous sinus. Most important one that we'll discuss in this tutorial is the cavernous sinus syndrome. Cavernous sinus syndrome is characterized by caroticocavernous fistula and cavernous sinus thrombosis. Here are some details of these abnormalities. Hope you enjoyed this lecture. Do like, share and comment on this video and subscribe to our channel.